Right, everyone, welcome. Today we're working on chapter 2, going over chapter 2 of Unlearn Your Pain. So I'm very excited to talk about this chapter. Has some really interesting information and studies. And I've made some slides like I did last time. That was helpful, I think. And so, hi, everyone. Hey, welcome to people who if you were celebrating Thanksgiving yesterday, and then today's Black Friday. There's kind of like some energy and busyness in the air. If you're in the US, I know not everyone is. So especially welcome to those people. Yesterday was my birthday too. So it's like tons of celebrating, but I also like to, I'm glad I get to meet with you guys. And there's a lot of people here, so congratulations for coming. And I know a lot of people watch the replays too. Oh, hey, Renee. Hey, Laura. Hey, Ryan. Okay, so I'm going to go ahead and I'll keep an eye on the chat, but I'm going to share my screen and get to the presentation of chapter 2. And happy belated birthday. Oh, thank you. Had a really great day yesterday. But you guys, I have to tell you, just, like we know with this work, I had such a great day and like was feeling so good. I think my nervous system was like, you should start worrying about stuff. So last night, even after like feeling great all day, spending time with family, I started getting like these anxieties and worries. So I was able to label it and just notice, oh, I think it's because I was feeling so good. My brain was like, hey, you should start worrying about things. Had a few little symptoms, just some stomach symptoms, but it was very interesting. All right, here is our share screen presentation here. Oh, present full screen. Oh, maybe. Let's see. There it is. Okay. Book Club, Chapter 2, Unlearn Your Pain. Okay. So guys, there's a lot of research cited in this chapter, which I just love. So sometimes here I put the references, and sometimes you can just look in your book or on that PDF for the references. But basically it's talking all about mind-body syndrome, how it's misdiagnosed, how the medical profession is not dealing with the situation of chronic pain correctly, and how much more pain that causes. So just in general, this is from 2011, so it could even be different now. I'm assuming the trend is that the numbers are getting bigger and bigger. So in 2011, 110 million Americans were suffering with chronic pain. And the 5 most common health problems in the US are back pain, neck pain, other musculoskeletal pains, anxiety, and depression. And I'm just going to move this over here. If you're seeing that, sorry. I want to see the chat here too. So the 5 most common health problems causing disabilities in the US are, oh, I just said that, back pain, neck pain. So see if you fall into any of these categories, but even if you don't and you have chronic symptoms, this could still apply to you. But the most studied things are things like back and neck pain because they are so common. So people with mind-body syndrome do not have pathological changes in their body tissue. They have physiological changes that are reversible. So this is a common question that we get. It is like, I'm a moderator in the Tell Me About Your Pain group. And so many people new to this work would say something like, well, I have an actual leg length difference, or I have really tight muscles, I can feel them. So isn't that structural? When my muscles just on one side are really tight, something structural must be going on. But this is a physiological change that's reversible. I think of it like our nervous system controls the muscle tension, it controls our digestion, it controls the stomach acid production, it even controls inflammation and hormone production, and all of these kind of things. The nervous system, when it's dysregulated, the nervous system controls all these things. When it's dysregulated, especially chronically, can start to have some of these symptoms that are chronic. And we'll talk more about what's physiological and what's not, because so many people will get a diagnosis, think that their bulging disc is what's causing their pain, and then their pain continues because of that belief. So just noticing that, yes, you can have some physiological changes. When I had IBS, I was really having bloating. I was really having, GI changes. And those were real changes, but the cause was the nervous system, was the brain, was stress, not the food that I was eating. So you could have changes in blood flow, muscle tension, nerve firing patterns, and brain wiring patterns that create pain, all in the absence of tissue pathology. So that's what we're really trying to determine here. Is it actual tissue pathology, or a normal age-related change, normal physiological changes, or something that was brought on by the nervous system that can be, and the brain, that can be rewired and unlearned. We'll talk so much more about that, but that's the idea. So with whiplash, so like I said, backs and necks are the most studied. Whiplash is such an interesting phenomenon because, probably a lot of you have seen or known someone who's had whiplash. Maybe you've even had it yourself. And there could be an injury that's involved with it, right? Like there's a car accident and your head moves abruptly. But what we see is that they did this study in Lithuania versus Norway, where people in Lithuania who are told to get back to work after a car accident, they don't have long-term neck pain called whiplash. And other countries where we're treating whiplash, that's where we see more of it. So first of all, it's interesting that they do have car crashes in Lithuania, but they don't have whiplash, that chronic condition. And in fact, the degree of the injury sustained is not correlated with the likelihood of developing chronic pain. So how severe the injury was doesn't even indicate if you're going to get chronic pain or not. In fact, a lot of cases, people are more likely to develop chronic pain when it's a milder injury rather than a severe injury. So sometimes we want to say, well, it was a really bad accident, or, I played sports for several years and I really just destroyed my cartilage. You hear these kind of things, like if it was really bad, then the pain is going to be worse and that it's going to be more chronic. And that correlation is not found. It could be a very mild injury and still have chronic pain from it. Oop. Okay, so the most interesting study I think about this was a placebo car crash study that they did. So they simulated a car crash. They broke glass. They made it look like the car had been hit, but the people's necks didn't actually move. And 10% of the people, after 4 weeks, 10% of the people still had pain. I think it was like at first 20% of the people developed pain, even though there was no movement. But if you think about it, there was trauma, right? There was some scary things. So 20% of the people developed pain. In 4 weeks, 10% of the people still had pain, even though there was no injury. There's no chance their neck was injured. And what they found is those people that developed the pain were the ones that had the most stress and emotional distress in their lives at the time of the experiment. So that just really goes to show when you're in a stressed out state, your body can take something like an accident and then amplify the pain from that. Even a pretend accident where there was no neck movement, they developed neck pain as if they had injured themselves. There's another case later he talks about where a woman put on glasses and developed migraines. And that was something innocuous. That was something that would not cause, some pathological change in the tissues. But because of a time of stress and then putting on the glasses, the brain, linked that and started displaying those symptoms. but it was really not correlated with any kind of tissue damage at all. And then they have the case of demolition drivers. So these are people purposely crashing their car for sport. And almost none of them have chronic neck pain, which you would think, doing collision after collision, they would be the higher risk for people to have chronic neck pain. But because they love their job or whatever, right? They are doing it for fun, they're doing it on purpose. Hardly any of them have chronic pain. Okay, another interesting point about back and neck pain. Oh, I'm going to move this. I don't know if you can see that. There we go. Okay, so with back pain, back and neck pain, this is fascinating. The height of back and neck pain, when people have it the most, is between ages 45 and 64. And then back pain actually rates start to decrease after age 65, which generally is the time when people are retiring from their job and maybe there are less stressors from work and things like that. Now, some people have other stressors when they retire, so it's not like, all the pain goes away, but very interesting fact. You would think that if things are getting worse with age, more degeneration, you should have more pain, but that's when pain actually decreases. And then almost all people will have some sort of abnormality seen on X-rays, CT, or MRI scans. So I'll have a chart on the next slide, but there are a lot of very scary sounding diagnoses that you may have gotten if you've had an MRI or an X-ray. And so you may think, well, this is the structural cause of my pain. It's this spondylolisthesis, or it's this annular fissure. Scary sounding things, but what we find is that people who have no pain, when we do MRIs on them, they also have those types of abnormalities. So if it can occur pain-free in some people, then that's not the cause of pain. In fact, if you take an MRI and you just gave it to a doctor, they would not reliably be able to predict how much pain that person is in just based on their MRI. So part of what has been hard is we've been looking at it through this medical model of like, if we have pain in a certain area, it's because something in that area is broken. If we can just go in with a microscope and go in and figure out, what exactly it is and fix that thing, then you won't have pain anymore. But we know that actually people have arthritis, they have bulging discs and don't have pain now that we've studied pain-free people. We were just only doing MRIs on people who had pain before. So it's estimated 60 to 90% of people without back pain have bulging discs, degenerative discs, arthritic changes, spinal stenosis, and other common changes. So it's just, these are common changes with age, and it doesn't mean that they're causing pain. So this is that chart. You can find it in the PDF. It's super helpful to see. Now, maybe you don't see exactly your diagnosis here. It's so much easier and nicer sometimes when you can see something that's been studied a lot that can help your faith or belief. But just giving you an idea of like when you're in your 20s, 30s, 40s, and as it goes on with age, it's very normal to have things like disc degeneration. Like I'm in my 40s, so 68% of pain-free people, like if I was to go get an MRI, there'd be a like 68% chance that I'd have disc degeneration, a 50% chance that I'd have a disc bulge, any of these types of things. And then this is all studying pain-free people. This is the occurrence in pain-free people. Kind of crazy. So these are normal signs of aging. And so reconceiving, like these are not dangerous, is one of the main things that we're doing in the first chapters of this book, is to really try to identify what's going on with you and if this could be mind-body syndrome. And then if you believe, so if you're giving a diagnosis and you believe that you have a bad back, your pain is more likely to last longer and become more severe. So a lot of times people are even given a diagnosis and then their pain increases more once they're given a diagnosis, especially if they're told things like, you'll never really be pain-free again. This is a chronic condition. We don't know how to help it. Like those kind of things really increase people's pain. Now, what are we looking for as far as medical structures that do show tissue pathology, a fracture, a tumor, or an infection? Those kinds of things are what we should be using MRIs for. Oh yeah, and Laura, I was just looking at the chat. It's crazy. They tell you you have degenerative disc disorder disease. The minute you hear it, you feel broken. This was me in my 30s. You are not alone, I'm sure, Laura. It actually starts to make me a little mad and frustrated. And I was a physical therapist for 20 years. So I told people a lot of things about, their asymmetry and the imbalance. And if we could just correct all these things, then you'll be pain-free. It's kind of perfectionistic. But, when we look at it as, oh, you have a normal thing that most people your age have, then you start to look at it differently. And then the treatments that we have for back and neck pain and other chronic pains have not been shown to be effective. Surgery, injections, narcotic pain medications have not been shown to be more effective than placebo treatments or conservative treatments. Okay, so the treatments that we are usually given in the medical system often are not even shown to be more effective than a placebo. That's true for spinal surgeries as well as injections. Oh yeah, and Roseanne, she was asking about the leg length difference. Again, there are many, many people that have these structural asymmetries that do not have chronic pain. So even in the book, The Way Out, there was a woman with scoliosis, 70 degrees. So her back was shaped like an S. And she became pain-free using this method, chronic pain-free, even though she still had the scoliosis, right? So we need to kind of detangle these structural things from causing pain in our mind and start to see it as, there are a lot of people, if you studied pain-free people that have poor posture, that have weak core muscles, that have, weak pelvic muscle, like strength and symmetry does not equal pain-free. And because you have chronic pain does not mean you have one of those conditions that needs to be treated that way, right? Surgeries can make back pain worse in a lot of cases. I saw that all the time with physical therapy. And then the treatment of chronic pain with narcotics can actually worsen pain because they can increase the nerve sensitization. So there's a little case study about a woman named Helen. And I just wanted to put this in here because this is pretty gnarly. If I had heard this MRI report as a physical therapist, I'd be like, oh, no wonder you have pain. You're tolerating your pain so well. But now I have such a different paradigm. But listen to this: severe disc space narrowing at L4-5, flattened discs at 2-3 and L4 or 3-4. Disc bulging with flattening of the spinal cord, narrowing of the outlet for the spinal nerves at L2-3, 3-4, 4-5, and L5-S1. The right L4 and L5 nerve roots are compressed by a disc. So I've heard people saying, but yeah, mine, I have nerve root compression. So people are actually people are actually able to become chronic pain free and out of chronic pain, even when they have a nerve root compression. Crazy, right? They don't have to have surgery for it all the time. Like, it's not saying never, but it's a very rare case that would need surgery versus the majority of people do not. The facet joints are swollen and there's spinal stenosis. So that's one of the more severe things that I've read, right? Like sometimes I would get some people with one or two of these things. But fortunately, Helen was able to get this treatment and became chronic pain-free. And then when she did have pain come back, she was under a time of stress and realized what to attribute the pain to, and the pain quickly went away. There's another case study of Catherine that, again, these are kind of things as a physical therapist, I'd be like, okay, let's just correct all these things and then you'll be pain-free. Pulled hamstring. So she had injured herself years ago. So if it's more than 3 to 6 months, that's one of the clues that things have healed, and this is this learned neural circuit behavior. So Catherine had a pulled hamstring, IT band syndrome, sacroiliac joint instability, a leg length discrepancy. She was diagnosed eventually with piriformis syndrome. It starts talking about how she starts getting hip and shoulder pain. And she also had multiple stressors in her life and very high expectations of herself. So this is her quote. "I'm so happy to say that I now have the ability to recognize that my pain is caused by an accumulation of anger and guilt in my mind, and that it uses my body as an outlet, and I no longer allow it to do so. This has taken work on my part. However, I'm thankful that I'm able to now let go and be pain-free." So many people, especially, if they've had a history of being active when they were younger, or maybe, there's a belief that every time I exercise, I get injured. Some of those things, it could just be your brain and your body and those stressors producing that symptom that you're feeling. And especially, like I said, if it's been over 3 to 6 months, I would have a lot of questioning about what's going on. All right. And especially if you've tried all the medical treatments and they haven't worked, right? A lot of people, I feel quite confident that they've explored all of the medical treatments, because they tell me, for several years, I've tried injections and physical therapy and, all these different things, and it just hasn't worked. So that's another sign. Okay, fibromyalgia. I can't see you guys, but there might be some people with fibromyalgia here, or that have been diagnosed with fibromyalgia. By definition, if you have been diagnosed with fibromyalgia, they have not found any tissue pathology, right? So they've already, looked to see if there's a tumor or fracture, infection, but there is definitely still pain, right? It's not fake. It's not all in your head. The pain can be widespread. It can be severe. They said it could even it can feel as severe as a bone fracture to people, poor people, right, that are suffering with this. And then, the medical system a lot of times hasn't known how to treat this. And so there's a lot of frustration and, kind of, maybe being labeled like, this is all in your head, you're making this up. And that can add to the stress, right, of fibromyalgia. And then also, people with fibromyalgia commonly have lower back pain, migraine, or tension headaches, TMJ, temporomandibular joint pain, IBS, irritable bowel and bladder symptoms, insomnia, brain fog, or many other mind-body syndrome symptoms. Oh, and anxiety and depression and PTSD. So if you look at the whole picture, there may be multiple things going on, all of which are stress-related MBS symptoms. And then he has a few statistics of research done with fibromyalgia. Dr. Schubiner has been involved in several studies with people who have been diagnosed with fibromyalgia and have seen really good results with this treatment. And then what I thought was interesting here is they actually have compared this treatment with traditional cognitive behavioral therapy, CBT. And so it's not just getting like mind-body therapy or working on your thoughts that helps, because a lot of times with traditional cognitive behavioral therapy, they're like, okay, here's your diagnosis, and how are you going to think of that differently so that you can feel better in your life? But with this treatment, emotional awareness and expression therapy, or as they simplify it in the way out, they call it PRT, pain reprocessing therapy. Sorry. There's actually a greater proportion of people that get better with this approach than just traditional CBT. So only 9% of the people treated with CBT had pain reduction, but or more than 50% pain reduction, but 22% of people with this method would have more than a 50% reduction. So that we're getting into all the details and numbers. And like I said, you can look back at the book for references, but I wanted to just highlight a few of them that really stood out to me. So I'm going to just go back to this. Okay, this is a really good question that's relatable to what just happened. Why are the results of 22% of patients having reduction of 50% considered as very good? So I think that is because with fibromyalgia, a lot of people have had it for years. As said on the previous slide, there are a lot of other diagnoses that can go along with it. So a lifetime of these patterns of thoughts and beliefs and, neuroplastic patterns. I'm not sure what the timeline was that they gave the people. Was it anyway in that particular study? But we're not looking for necessarily perfection here. And for some people, the results of some of the PRT studies make it sound like, well, within 4 weeks, everyone should just be pain-free. But seeing this as like a lifestyle change and an approach for changing those pressures we're putting on ourselves, having better boundaries, not being people pleasers, not taking on too much, mitigating other stressors in our lives. So with some people, it is a slower process, but especially for things like fibromyalgia, that is considered better compared to other treatments. It's considered very good. Okay, so headaches. Most people that have chronic headaches or migraines have normal CT scans and MRIs. So most people, when they do a CT scan or MRI, they're not finding a tumor or a fracture, of course, or infection. And even some people have a genetic component of migraines. It runs in their family. But when we think of genetics, you want to think of genes functioning with this epigenetic manner. You might have heard that term epigenetic. It means that we have our genetics that we're born with, but the environment actually changes our genes. We actually know that's true. So depending on the stressful environment we're in or not, it could change the gene expression. So even if you are, have a lot of people in your family with migraines, that also could be, a lot of people in your family think a certain way and have a stressful life and put a lot of pressure on themselves, right? Like that can be genetic too, some of our beliefs and thoughts and behavior patterns. So looking at, even if you do have a history of genetic history of migraines, the genes can be turned on and off by life stressors. So people with migraines can get better despite having a genetic predisposition for it by using this program. Very cool. Other conditions that are typically manifestations of mind-body syndrome could be chronic abdominal pain, pelvic pain, TMJ pain, irritable bowel syndrome, irritable bladder syndrome, known as interstitial cystitis. I'm like, all these words, getting my work out of my mouth here. Chronic fatigue, tinnitus, or tinnitus, if you say it that way, insomnia, anxiety, and depression. Yeah, my increasing vocabulary. Yeah. It's like I know all these words and I go to say them, and interstitial cystitis. Okay. You know what I'm saying. I'm not going to read through all of these, maybe for that reason, but this is in your book or in your PDF. It's not a complete list. It's not like, it says repetitive stress injury. So you might be like, well, I have tennis elbow, and I don't see that on there, but that would be one of the repetitive stress injuries or myofascial pain. So basically it could be pain syndromes in any part of the body that have lasted chronically longer than 3 to 6 months. It's highly suspect unless you have a tumor or infection or fracture that it's this mind-body syndrome and can be unlearned, which is amazing. But you might look through this list and find some that surprise you. I mean, POTS, that postural, why did I choose this one? I'll say it, postural orthostatic tachycardia syndrome, POTS. A lot of people might think, well, this is just, something neurological that's going on with me, and I've been diagnosed with this, but it's actually possible to unlearn those symptoms. Same with like reflex sympathetic dystrophy or CRPS, like that is one that can cause severe even atrophy or inflammation. but it's these pathological changes that can be reversed. Even things like multiple chemical sensitivities. You hear a lot of people with like mold intolerance and chemical sensitivities. Great news, because all of these things can be unlearned. Why doesn't my doctor tell me about this? Like, why didn't my doctor educate me on this? They just don't know. They don't understand about chronic pain and this disorder and the training on chronic pain. You know, maybe your doctor went to school 20 years ago. Like, you know, my physical therapy school was over 20 years ago. And even then they were teaching some different things than they teach now as far as like treatments and stuff. So imagine, you know, all this research was just starting to be done back then as far as studying healthy people and their backs. And so just because your medical provider tells you this is what is going on and it's this diagnosis, if they're not familiar with mind-body syndrome, you know, it's not like they're right and this is wrong. It's just like we have newer information now. Traditional medical treatments are geared towards correcting the pathology in the body. You know, like, oh, there's this disc bulge, we're going to go and do a discectomy and remove it. But in mind-body syndrome, there are reversible physiological changes to the brain and nerve pathways, no underlying tissue breakdown. So this is where, well, I won't get into it. There's kind of some stuff with autoimmune. You know, it's not really described here, autoimmune stuff, because with autoimmune, there can be changes to the tissue that require medical attention. So what I was dealing with was ulcerative colitis, and ulcerative colitis is an autoimmune, but it had to do with me being really stressed in my nervous system. And once that was calmed down, my immune system stopped attacking itself and the disease process was healed. But, you know, if there is a disease process, there sometimes you do need to do medical care as well. And injured nerves do not have a calendar and may indeed take longer to heal than 3 to 6 months. True. And sometimes things are diagnosed as injured nerves that aren't. You know, if someone has had a nerve conduction test, that may indicate damaged nerves, but oftentimes people are diagnosed with a nerve injury because of symptoms and not because there was an actual injury. Or like we saw in that previous example, there was someone with nerve root compression that, you know, it actually was there. The nerve root compression didn't change, but the symptoms were gone. So it is a little tricky. I learned that too, that nerves, you know, they take longer to heal. They heal at only 1 millimeter per month. But I also question a lot of how we're diagnosing nerve injury, because a lot of times it's just symptom-based rather than actually a nerve conduction test. So yes, there are always going to be a few exceptions to these general statements, but they are the overwhelming minority. Like the overwhelming majority of people, even with nerve type symptoms, it doesn't necessarily mean that there has been nerve damage. Yeah. So medical professionals have unwittingly created a form of mental imprisonment called medicalization, where when diagnosis and treatment cause increasing pain and suffering. So again, that idea that we're given a diagnosis and it's chronic and there's nothing you can do about it, but like, you know, manage your symptoms, that often leads to more pain in people. Yeah, so sorry, I'm just going back to the chat. I did not know that nerves can heal. Is that information in the book? I overlooked it then. No, that was just what I learned as a physical therapist years ago, as far as nerves healing, you know, at this rate. But again, I would be really curious. One of the things we'll learn later in the book is with those fit criteria. If there are ever any times that you don't have those symptoms, that can be a sign that it's not actual nerve damage causing the problem. So for some people it is constant, but for some people they might have some pain one day and it's worse another day, and then it's better another day. So those kind of things show that the nerve isn't truly damaged. Not that constant pain always means that it is damaged, but again, just noticing, you'll see as we go throughout this book, little ways of starting to examine for yourself. True nerve damage causing chronic pain is very rare. And then I don't think pain coaching is covered by health insurance. It's the trend, I think, is changing, but definitely all this research is new. So it is a little frustrating that the things that are covered are things that are not shown to work, and things that are shown to work are generally not covered. Oh, I think that's the end of our slides. Okay, I'm going to stop the share. We're going to go to our chat or our questions here. Are there people that have a question that they want to talk about here that's related to this chapter that we just talked about? I know last time we kind of ran out of time answering all the questions on the chat. And so it might be interesting to get to some feedback for you guys today as much as we can. So Roseanne says, with tinnitus, I'm told that hairs in the ear just lie down. They don't know why. Tinnitus came on at a very stressful time in my life. How much experience do you have clinically with tinnitus responding to PRT? It's a good response. I mean, I have had a handful of people that even when they came to me for their other, it was like back pain or shoulder pain, they said, oh, I had tinnitus before, but it has gone away, you know? So definitely with this approach, just that idea, like, this isn't dangerous, seeing it as more like, how am I stressed? How am I stressing myself out? That has really, really good results with tinnitus, especially since there's really nothing physiologically causing it that they know of. Tanya, you asked how new is this study, and I'm wondering which study you're referring to, because I'm just referenced a few different studies there, so I'm not sure when you wrote that. Did you have a question? Yeah, Tanya.
Yeah, because you said the study is relatively new and not so many doctors are familiar with it, so I was wondering, it's probably from 2009, I think.
Which
the
study
books has
specifically?
There's a whole PRT and
Oh.
emotional awareness and expression therapy. The first book was published probably in 2009, and in Alan book is he started working with patients like in 10 years ago at least. No, am I wrong?
Yeah,
because
yeah.
I'm just wondering why when will doctors know about it?
Yeah, I think that's a complicated question because you know, most of the training from medical doctors comes from, like, the pharmaceutical companies do research, and that's like a big part of medical training, is like what the pharmaceutical research is finding. So as far as I understand, and I'm not like, you know, I don't know all of this, but like, when the pharmacological companies are funding research and then helping train physicians, you know, that is going to perpetuate a lot of people looking for the medical approach and not changing. But I mean, things are definitely shifting. Dr. Schubiner used to be a traditional medical doctor. Dr. Clark as well was a spinal surgeon, and now he does the mind-body approach. So I wish I could tell you when, but definitely the work that we're doing and talking to other people. I actually have been lucky enough to coach a lot of physicians, because a lot of physicians actually have chronic pain too. And they, you know, they're desperate too. They want to find what works. So I think we're just like slowly changing things, but I can't see it like drastically changing very soon, because there's so much in place that, you know, wants to keep it going how it is. Surgeries are profitable. There are people making money off of, you know, all the hardware that goes into a spinal surgery. I mean, it's a billion-dollar industry. So people aren't as excited to say, here's a way that you can heal yourself, you know, when they're making money off of other stuff. But like I said, Dr. Clark was a spinal surgeon and left that for this approach.
Thank you.
Yeah, no problem. Wish I could give you a better answer, but. And then Ryan says many doctors never truly update their medical paradigm. They think they know it all already. Yeah, I mean, that's for sure something that we'll see. And like I said, people are kind of getting fed up with the system too, and seeing how there are holes in the system and it doesn't help everyone. And where so many people are dealing with chronic symptoms, like the medical system is really great for acute symptoms and for certain things. But once we get into chronic pain, where it's this learned pattern of the brain, most of the way we treat it medically is actually making the fear and the pain response worse. Yeah. Oh, the new documentary Alan Gordon did, Pain Brain, speaks about this frustration about difficulty disseminating. Words are hard today. So hard to get the word out. Oh, that's what you just wrote. Disseminating. Their hope is the randomized controlled trial of the Boulder back pain study being published will spread more and be replicated, etc. Yeah. So I haven't watched the Pain Brain. That sounds actually kind of interesting. Maybe I'll do that today. But yeah, it's hard to change the whole paradigm. And then Claire, it's hard when one provider tells you pain is structural, neuropathic, go for surgery. Another tells you it's MBS. I have foot pain, it's constant, same place all the time for 3 years. I 99% believe it's MBS. I think that 1% is the problem. I'm also a physician, so we're not all totally ignorant of this. It is true. I love, thanks Claire for that. I think a lot of, like I said, people are hungry for this information because what we're doing isn't working. So I know a lot of us have probably had negative experiences with physicians at one time or another, but not everyone is ignorant of this or unwilling to learn. And yeah, Claire, it is hard when there's that 1% of you that thinks, oh, maybe something structurally is going on. But I've done some research just like with like Morton's neuroma, for example. I just Googled, can Morton's neuroma occur without pain? And I found this one study that they, I think I mentioned it last week. They examined people post-autopsy or whatever, and found that I think it was like 10% of the people had a Morton's neuroma who didn't even have foot pain. So you might be able to find some of those kind of things, but it's hard if your specific thing that you are diagnosed with, there's not a lot of information about it being mind body. Ryan just linked up the painbrainfilm.com if you want that reference. I'm going to watch that. So yeah, Claire, do you want to come on and talk about anything with your foot, or is there anyone else who wants to come on and ask another question? Because we have some time. I don't want to just talk the whole time. I want people to come on and interact if you want. And I can only see a few of you. Is anyone like raising your hand, or you can unmute? Let's read the next one. You guys be thinking if you want to come on and ask a question or have some kind of insight that you want to share.
I'll go on.
Oh yeah. Tanya. Is that you? Oh wait, no. Who is that? Oh, okay. Roseanne. Sorry, I just see like just a few. It's only showing me. So hi, Roseanne.
Hi, I want to thank you for holding these book clubs. They're wonderful. Thank you very much.
My pleasure.
I just want to say I was a chiropractor for 33 years. And so, chiropractic physical therapy, they're similar. Anyway, so long story short, I discovered Curable a year and a half ago in April, and I just made a steady trajectory towards, you got to get it. I wasn't really able to be a full-fledged chiropractor. I had a lot of things going on. I was in a toxic marriage, tons of stuff going on, right? Anyway, long story short, and I was imbued in structural like you were.
Sure.
Right. And then I started putting the pieces together, and I had 3 weeks last winter where I was almost symptom free unless I had to talk to my husband. And then I moved out and I had 5 weeks this past August, September, October, where I had lost my pain brain. It went away. And I could feel my nervous system just relaxing steadily. And I thought, oh, well, maybe it was from all the stress in that marriage. And then I did some exercises with the physical therapist, some clamshell exercises for those of you. You're on your back and your knees are bent and you externally rotate your hips. Well, I never would have done that in the first place if I had my hypervigilance happening. It was just like going away. And long story short, I flared up my symptoms. And I thought they would clear up sooner than they have, but I'm going through a divorce. We have foundation damage now. There's a tumor on my spine. I have to get looked at. So I'm just really stressed, but I have to go back to what gives me hope. And I had 3 weeks last winter and I had 5 weeks in August where the only time I had symptoms was when I had to talk to my husband for more than a minute.
Wow.
That was the only time I had symptoms.
Yep.
So but like you, I'm steeped in the physiology. And so I've got to get it out of my brain. And then I beat myself up, right? Oh, you externally rotated your hips. Why did you do that? And then a bunch of things happened that I'm just kind of set back. So I was wondering if you would talk about that a little bit.
Yeah. So it sounds like there's a big part of you that believes it's mind-body syndrome. This is so common. And then there's also this questioning part that it's like, well, maybe I really did do something. And because when did that pain start again? You said in August, it was 5 weeks without pain. And then
I went from mid-August to the beginning of October where I was like,
yeah. Okay. Yeah. Okay. So here are some like kind of general things I would advise for anyone is just notice your reaction to the pain. So you might have an emotional reaction, and anything that's a reaction of fear. So it could be worry or anxiety, or it could be frustration. It could be annoyance. It could be urgency.
yeah.
Yeah. So if you're going into one of those fear-based states, then definitely that could be something to soften or to work on. So I like to even use this pain catastrophizing scale, and I can link it up. I'll put it in the tell me about your pain group, and actually I'll put it in the PDF in a few different places, but sometimes this is helpful to me and to my clients is just to notice when I'm catastrophizing. And they actually got this from pain science research. They can measure how much people catastrophize, which is how they're thinking about their pain when they have it. And the more that you catastrophize, it's shown to have new symptoms come up, or new symptoms become chronic, or even have a recovery that's longer after surgery. So, and some of the statements are pretty general, like, I anxiously want the pain to go away, or I keep thinking about how much it hurts. I've become afraid that the pain may get worse. So sometimes you can just notice that you're catastrophizing. So notice your reaction to the pain. Is it fear-based? Chances are there's something fearful about thinking, hey, it might be structural, or it might be physiological. And then sometimes I like to just say, like, there's my brain catastrophizing, just to kind of dial it back. Like, okay, my brain's going to get in this fearful mode, but I can just label it, oh, this is just my brain being afraid. When symptoms are bad, definitely, this is more of the approach stuff from the way out. And we'll get into, the deeper stuff with Dr. Schubiner's emotional expression and stuff. But just in general, when symptoms are bad and you can't kind of like reason your way out of it in your head, and especially when your head is full of this medical information, sometimes it can be helpful to find some things that distract you. So the avoidance behaviors, Alan Gordon calls it, and sometimes we have resistance to those avoidance behaviors because we feel like we're not doing it right unless we're journaling and processing and somatic tracking, and but sometimes it could even be like you increase the things that bring you joy and peace and that nervous system state of safety. And then those symptoms are going down. So you could address, kind of the thoughts, but when you have those conflicting thoughts, sometimes it's nice to have a few tools in your tool belt that are just pure distraction. Like I love, getting some kind of mindless TV show. I used to never let myself watch TV, but now I'm like kind of proud that I can watch some reality show that's just gets my mind off it. And seeing that as a helpful tool, not to overuse, but just like have some good tools of, complete avoidance type of things. Taking a nap is always a good one for me too. When my stomach pain gets really bad, taking a nap. So does that help to think of decreasing the catastrophizing, increasing the pain, or increasing the peace? Yeah. You said, yeah, with your thumbs.
I just want to say, I used to go on the Curable Facebook page when I usually in the middle of the night, right? But anyway, I want to piggyback with what you said, Betsy.
Yeah.
And I would write stuff on the page when I needed some support, and some beautiful person, I was catastrophizing. Ew, I didn't realize it was catastrophizing, but I kind of did. And somebody posted a picture of a road, a long, maybe 2-mile stretch of a road. And there was a little tiny blip, maybe 3 or 4 or 5 inches high on the road. And that really helped me mentally to think, oh, it's just a little blip. I haven't been able to I need more fresh things, but it really helped me so much. When I saw that, I'm a visual person like many of us. When I saw that little blip on the road, it's like, oh my God, the fucking road is just a little tiny thing.
Exactly. Yeah. Usually when we're catastrophizing, we're taking this tiny thing and we're like, it's going to be forever. Or the other thing I commonly hear is like, I'm doing it wrong, or maybe I'm just not good enough to do it. Maybe I do believe it's mind body syndrome, but obviously I'm not going to be able to do it because I don't have I'm too weak, or I'm not good enough. Yeah.
Right.
Yeah. And me too. I've done that before, especially I remember at the beginning, I remember getting, some symptoms and just being like, maybe I can't teach this. Maybe none of this is true. Like maybe I'm not, like, how can I teach this to people if I still get some symptoms? But seeing it as I started, even at the very beginning, I don't know if you heard, but like, I had a really good day yesterday. It was my birthday and Thanksgiving, and I just felt so grateful. And then even last night, I caught myself starting to get some symptoms and thinking of just worrying about things, because I think our nervous systems get kind of into that high alert state, that when things do start to go well for a while and you're feeling really good, our nervous system's just like, hey, don't forget, we should worry about like what might happen in, 3 years if you don't do that. You know what I mean? It's just like, so I was able to be onto myself and just really acknowledge that fear. Oh, you feel afraid. You're, this is temporary. We've got this. And I listened to some meditations that really helped me and some things like that. But it does get easier to believe that the symptoms are neuroplastic when you've had some times of remission, I think. But not everyone has had that. So that, don't say, well, it's easier for you guys. But anyway, yeah, I think that just trying to get as objective as you can. So you can almost, like, I imagine being the observer of myself. Oh, there's my brain going into this high alert mode. And really all that's going on is I had a really good day. And now I'm scared that things are going to be bad again. And I'm almost starting to create it by my own thoughts. I was starting to create it by my own thoughts. So, and that used to be really frustrating to me. And I know that's frustrating to some of my clients, of like, why can't I just, handle things better and not be so weak? But the more we see it as, this is just, I do this wave up and down movement with my hands where it's like, this is the normal process of life. When we're down here and we're like, oh, why am I here again? Then we have a lot of resistance and we actually stay there. But when we're like, oh, things flow, this is temporary. When I'm down here, I know, within a few days, I'm going to be coming back up. Like once we start to see those patterns and find those patterns and believe those, it gets a little easier. But I still get symptoms. They're not chronic, but they just indicate to me that I'm stressing out. And then I know how to deal with that without chasing all the symptoms. But I still, you know, if I have, like, I took a peppermint pill last night, I was like, my stomach is so grumbly. I'm just going to take a peppermint pill, even though I know that it's my brain and nervous system causing it. So that's another thing that they say as avoidance behaviors. You know, maybe you do take a bath or you put that heating pad on or something, but you're also reminding your brain, this is the cause is this fear in the nervous system, but I'm doing this to help my nervous system, to assist it, like training wheels. That's what I like to think. Okay, thanks for bringing that up. Thanks for coming on. I'm going to look back at some of the messages I've gotten. Laura was asking me how long it took to resolve the IBS symptoms. Geez, that is a really hard question. It seems like it should just be like, oh, this is exactly the day I was symptom free. I would say maybe about 6 months, but it was like up and down. And like I said, sometimes I'll still get some symptoms. They're just not chronic. But I don't have like a specific, you know, timeline that I was like, I did this and then it stopped. Because when I was starting with this work, I had Dr. Sarno's book, Curable had just come out, but like the way out wasn't there. There wasn't as much support. I hadn't done the trainings with Dr. Schubiner and Alan Gordon. I think now it might have even been a little faster because I have so much more information. But back then it was like 5 years ago and all this stuff was pretty new. And then Katja is a doctor in Denmark. She said, I definitely think there are differences between countries too. And if there's universal health care or not. Treating chronic pain non-medically is the norm there. Surgeries and injections are rarely used. MRIs are interpreted according to what's normal age-wise, and if the findings correlate exactly to the placement of symptoms. 10 years ago, I believe it wasn't like this. So things can change quickly. Yeah. Oh, I love that. Cause like Europe, I think maybe is a little more advanced in this, right? A little more because it's universal healthcare, right? There's not as much vested interest in people who have a lot of money to do these medical procedures. So things are changing, especially in Europe, especially you might be a little more in luck if you're in Europe, but things are changing here too, for sure. And then Claire, we're just going to probably end with this. After an increase in pain last weekend, I think due to some family stress, I was so sore. I was back to researching surgery, yeah, and freaking out. Back to baseline pain with my usual routine, but feels like it's always lurking and never goes away. Okay. So I'm glad that you're questioning some things and that you're here. And definitely some of those statements like this is from the pain catastrophizing scale. There's nothing I can do to reduce the intensity of the pain. I can't seem to keep it out of my mind. I wonder whether something serious may happen. Like, again, just identifying that you're catastrophizing, even in that statement of, I feel like it's always lurking and never goes away. Just notice that's how the brain is thinking right now. It's more likely to perpetuate those symptoms. But that's where, if you can, this is another technique they talk about, incurable, and Alan Gordon calls it an evidence sheet, but detective for the opposite. That one is so, so powerful. I find it powerful for these beliefs and even any other kind of limiting beliefs. You know, if I'm like, I'm a bad mom, then I could look for detective for the opposite moments. Oh, I did, you know, make sure my kids had food today. I did, you know what I mean? You could, like, most of the things we think, the direct opposite is also true in some ways. So if you feel like the pain is always lurking and it never goes away, if you can, start from now on to shift to looking for any little glimmers, any little moments. Sometimes when we feel the pain, it's a contrast to what was just happening. And so we're like, wait, I guess before that I wasn't feeling it, you know? So I'm not saying that's happening in every case, but usually most people that really try that detective for the opposite, they're able to use their powerful brain instead of looking for danger and high alert, starting to shift your brain to look for the times it feels better, the times that it's less than you expect, and the kind of things that you can do that increase your pleasure and joy and calm and safety feelings, and how that's correlated to less pain. But I guess I'll just say to end, because I already said I was going to end with this, but one last thing that came to mind is just as we go through the book, we'll start to see more about the personality traits and ways we put pressure on ourselves. But especially this time of year, I just want to, give an extra reminder to anyone who's getting more symptoms that a lot of this, we can look at the ways that we're stressing our own selves out, and we can start to modify there. And that for me has been the biggest thing, because I was just such a high achiever, perfectionist type of person, and, really self-critical. Someone could give me a compliment and I'd be like, yeah, they didn't really mean it, or they were probably just saying that. Like, it was just, I didn't realize how much stress that was causing my body, just the types of thoughts I had about myself, and the way I was putting pressure on myself, and being a people pleaser, not having boundaries, and saying yes to everyone, and then feeling resentful. And so look for that, you guys. I know it isn't the chapter we talked about, but since the holidays are coming up, and we'll have a few more weeks to dive into this a little more, but as you are looking for those ways to calm and soothe and send messages of safety to your brain, then also looking at those things that you might be able to change. And maybe it's just giving yourself some extra time to take a nap or to have some self-care. It doesn't have to be just like going on a trip, or, I had a massage once this week. It's like little micro moments of self-care, regulating the nervous system, being kind to yourself, that can really help. All right, you guys, I could just go on and on. I know I love talking with you and hearing your questions and all these people that came to interact. So thank you. We will be doing chapter 3 next week, and we'll just go from there. I'm on that Tell Me About Your Pain Facebook group if you have any questions. Oh, thanks, you guys that are saying thanks in the chat. Thank you for coming. And yeah, my pleasure. I've really enjoyed doing these book clubs with you guys. All right. Have a great rest of your Black Friday, and we'll talk to you next week. Bye-bye.